Skeletal muscle relaxants are of two types, centrally acting and peripherally acting. Skeletal muscle relaxants are of two types, centrally acting and peripherally acting. Peripherally acting skeletal muscle relaxants are of two types. The drugs that act at neuromuscular junction and the ones directly acting at skeletal muscles. Peripherally acting are of two types. First, drugs that act at neuromuscular junction and directly acting on skeletal muscles. Then the drugs that act at neuromuscular junctions are of three types: depolarizing blockers, non depolarizing blockers, that is, competitive blockers. Non depolarizing blockers are the competitive blockers, and others which has botulinum toxin A. So, skeletal muscle relaxants are of two types, centrally acting and peripherally acting. Peripherally acting are of two types, the ones that act at neuromuscular junction and the ones that directly act on the skeletal muscles. Drugs acting at neuromuscular junctions are of three types: depolarizing blockers, non depolarizing blockers or competitive blockers, and others, that is, botulinum toxin. See, non depolarizing blockers or competitive blockers are of three types: non acting competitive blockers, intermediate acting, and short acting. Non depolarizing or competitive blockers are of three types: long acting, intermediate acting, and short acting. Long acting non depolarizing blocker, example D-tubocurane and pancuronium. D-tubocurane is an example of long acting non depolarizing blocker. Example of intermediate acting: Atracurium and cis-atracurium, and short acting mevacurium. Okay. So non-depolarizing blockers या competitive blockers are of three types: long acting, example D-tubocurane or pancuronium; intermediate acting, example atracuronium or cis-atracuronium; short acting mevacurium. Long acting D-tubocurane or pancuronium; intermediate acting atracurium and cis-atracurium; then short acting mevacurium. ठीक है, फिर डी ट्यूबोक्यूरेन और बाकी सारे कॉम्पिटिटिव ब्लॉकर्स एट न्यूरोमस्कुलर जंक्शन के रिवर्सिबल के लिए वी यूज़ एड्रोफोनियम और नियोस्टिग्मिन. ठीक है, डी ट्यूबोक्यूरेन और बाकी सारे कॉम्पिटिटिव ब्लॉकर्स एट द न्यूरोमस्कुलर जंक्शन के लिए वी यूज़ एड्रोफोनियम और नियोस्टिग्मिन. ठीक है, एड्रोफोनियम और नियोस्टिग्मिन के कारण एसिटाइल कोलिन का कंसंट्रेशन इंक्रीज होगा एंड इट विल रिवर्स द न्यूरोमस्कुलर ब्लॉकेज बाय डी ट्यूबोक्यूरेन एंड अदर कॉम्पिटिटिव ब्लॉकर्स. ठीक है, बट मीवाक्यूरियम दैट इज शॉर्ट एक्टिंग and atracurium that is intermediate acting, they do not require such reversible. Mevacurium, which is a short acting competitive blocker at NMJ, and atracurium, which is intermediate acting competitive blocker at NMJ, they do not require reversal. Atracurium जो है वो intermediate acting है, that's why it does not require reversible. Atracurium, it has intermediate duration of action. Okay, it undergoes spontaneous degradation in the plasma known as Hoffman degradation, in addition to destruction by choline esterases. So atracurium का intermediate duration of action होता है और इसका spontaneous degradation हो जाता है, खुद से it degrades in the plasma by Hoffman degradation. और बाकी कोलिन एस्टेरेज से तो ये डिग्रेड होता ही है. तो एट्राक्वेरियम, बिकॉज इट undergoes Hoffman degradation, so it does not require neostigmine for its reversible because it undergoes spontaneous degradation in the plasma known as Hoffman degradation. और इसका कोलिनेस्टेरेज से डिस्ट्रक्शन तो होता ही है. Okay. Atracurium, it has intermediate duration of action. Atracurium, it is a competitive blocker at the neuromuscular junction जिसके कारण skeletal muscle relax होता है. But इसके लिए कोई भी neostigmine या edrophonium नहीं चाहिए for its reversible because it undergoes spontaneous degradation in the plasma by Hoffman degradation in addition to destruction to cholinesterase, destruction by cholinesterase. और ये हिस्टामिन का रिलीज करवाता है एंड इट इज सेफ इन पेशेंट्स विथ हेपाटिक एंड रीनल डिस्फंक्शन. So you need to remember that it has intermediate duration of action and it undergoes Hoffman degradation in the plasma, that is spontaneous degradation in plasma in addition to destruction by cholinesterase, and so it does not require neostigmine for its reversal.